Yeah.
Yes, of course.
Hello, I'm Dr. Sandra Cabot. Welcome to my webinars where I share information to give you knowledge and clarity to enhance your health and well-being. I've been a medical doctor for over 50 years and I know that knowledge is power. So let's go. Hello, everyone. Great to be with you today, and we're talking about the gut. And I'm joined by Igor, who is a mindset coach and helps people develop the right mindset to heal themselves, which is critically important. So welcome, Igor.
Good afternoon, Sandra. How are you doing today?
Pretty good, yeah.
Great to
Everything's
be here.
working, it's great. When your body's working, you got to be grateful for that, particularly at my age. Fantastic.
You're doing fantastic. You're healthier than a lot of people at my age.
Yeah, well, hopefully we can change that for people between us with our live streams. So, yeah, today we're talking about the gut, and I'll bring my presentation up. This is something that I know a lot about because we have so many patients who have gut problems, and often the first sign that you have a gut problem is bloating and irregular bowel actions. So it's not normal to bloat up after you eat. And this is something that you really need to investigate. But it's incredibly common. And, when you look at some of the reasons, you can see there, people rushing their food and not chewing properly. They may have irregular bowel actions. Constipation is very, very common. And this is something that people can have all their lives because they have an enlarged colon, a megacolon, and this is really unpleasant. So that can be checked with different tests. Celiac disease is another common cause of indigestion and bloating, and you don't have to be a celiac to be gluten intolerant. A lot of people are gluten intolerant, but they don't develop celiac disease. All they have is, problematic bowels and bloating, constipation, irritable bowel syndrome. Another common cause, particularly as you get older, is lack of digestive secretion. So you may not be producing enough stomach acid or bile from your liver or enzymes from your pancreas. So you need all three of those secretions to have a healthy digestion. For example, you can think that you have a healthy diet, and that's a whole subject on itself, but even if you do try and eat really healthy, if you don't have enough hydrochloric acid or digestive enzymes or bile, then you're not going to break down the food, you're not going to absorb it. So it's really not doing you much good. You may have a hidden food intolerance. So that's where an elimination diet can be really helpful. Probably the most common food intolerance is gluten or lactose or FODMAPs. FODMAPs are foods high in fermentable sugars. So there's a really good diet called the low FODMAP diet, which people can do for several months to get rid of the bacteria that are fermenting the carbohydrates in their gut. And actually there's a syndrome you may have heard of, Igor, called autobrewery syndrome. Have you heard of that?
No, but it sounds like a great way to make beer at home.
Well, you can save money, but unfortunately, it's happening when you don't want it to happen. So, autobrewery syndrome is where you have the wrong bacteria, particularly in your small intestine where they shouldn't be, and they ferment the carbohydrates in the food into alcohol. So you're brewing
Ah,
alcohol in your small intestine, and a lot of these people get a really foggy brain.
is that
So
because they're drunk all the time?
yeah, they feel like we can actually measure their blood alcohol, and it's elevated in people with autobrewery syndrome.
Wow. I wonder if they can get done for drunk driving.
Well, one of my patients was in that situation, where they got done for drunk driving, and
Oh my God.
yeah, I had to act as an expert witness to prove that they were, uh, making too much ethanol in their intestines. They weren't drinking, but they were eating a lot of sugar, a very high sugar diet.
Ah,
Yeah,
so interesting.
yeah, and the other thing that can cause bloating is hormone imbalance, particularly in women before menstruation. So that's lack of progesterone, overgrowth of parasites, small intestinal bacterial overgrowth. Now, we shouldn't have a lot of bacteria in our small intestine, which is up high. The bacteria should be in the colon. But in people with SIBO, the bacteria migrate up into the small intestine and cause all sorts of problems, particularly this fermenting of carbohydrates, but also they can release toxins. And if you've got a leaky gut, that gets into your blood and that can affect your state of mind, your liver, inflammation. So SIBO is not a good thing to have. It's not just unpleasant, it can have medical consequences. Um, Leaky gut, we're going to talk about that. That's very common, and that can cause bloating and also just general foggy brain and problems with the immune system. And the other thing we should mention, particularly in women who get a change of bowel actions or they have bloating, which is a new symptom, they haven't had it before, is we should do a pelvic ultrasound to check their uterus and their ovaries, because bloating and a change of bowel actions can be a presentation of ovarian cancer. So we need to check that and even do an abdominal ultrasound as well as a pelvic ultrasound. Yeah, so, if you do have this bloating and SIBO and fermentation of carbohydrates in your gut, it's good to go on a low carb eating plan and try and get most of your nutrition from animal protein such as fresh meat, eggs, poultry, seafood, and nuts, and also low FODMAP vegetables and fruits. So Monash University has a very good app. So you just Google Monash University FODMAP app, and it will tell you all the foods that are low in FODMAPs. So that can be very useful for people. You can also just do an elimination diet for a month where you give up the foods that are most likely to cause irritable bowel, such as gluten or lactose, and definitely foods that have additives like preservatives or colorings or flavorings. So make sure you have a good read of those food labels. Yeah. Now, in some people, grains can be difficult to digest, so that can be worthwhile giving up grains for several months to see the reaction on your gut, and also giving up dairy products. So those two things can be really worthwhile to eliminate strictly to see the effect. So we may have less bloating, less reflux, less cramping, and your bowel actions may improve a lot. So when we look at FODMAPs, they are a group of carbohydrates called fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So some people just have a very low tolerance to those substances, and eating them causes a great deal of bloating. And I mean, we're talking about huge bloating. You know, people will have a meal and their stomach will enlarge a huge amount, and it's very uncomfortable. So that's often the sign that you really need to go on a low FODMAP diet for several months. And a flat tummy can be great. You know, you can fit into your jeans and wear your belts and things again. Now, we usually only get people to do the low FODMAP diet for several months because it is a bit boring, you know, because basically you'll be eliminating some foods that we really characteristically see as very healthy foods, but they're high in FODMAPs. So that would include fruits like apples, pears, onion, garlic, broccoli, sweet potato. So we'll find that that could really help to reduce the bloating by eliminating those so-called healthy foods because they're high in FODMAPs and they may be fermenting a lot in your gut. Also, legumes and lentils are especially high in FODMAPs, and a lot of vegetarians will consume legumes and lentils for their protein. But if they're getting a lot of bloating and indigestion, that could be the reason that they're not able to digest and break down the FODMAPs. They're actually fermenting them. Yeah, so we mentioned that Monash University FODMAP app, which is fantastic. So you can try the low FODMAP diet for several months. It may really make a huge difference.
I was just going to ask if a certain foods can make you gassy more than others, is that a sign to perhaps that could be happening in your gut?
Yes, definitely. And keeping a food diary is really worthwhile because you may see a pattern. And typically it'll be, you know, the processed food that'll cause the problem because it's just high in a lot of things that are not meant to be in your gut and will cause irritation and inflammation. And for example, you know, processed food high in sugar or processed vegetable fats, your body just can't deal with that. And so that could cause a lot of bloating and actual abdominal cramping. So keeping a food diary is great. Now, SIBO is really interesting. You can see we've got a diagram of the small intestine there, and it's very, very long. You know, it's about 24 foot long, which is huge. So it's much longer than the large intestine, which is the colon. And you can see with the way the small intestine is, it's all folded up on itself. So there's lots of little curves and nooks and crannies that bacteria can build up in. And our small intestine is not meant to have a lot of bacteria. So these bacteria are migrating up from the colon into the small intestine, and that could be because you have a leaky ileocecal valve, which is a muscular valve that is meant to stop bacteria from going backwards from the colon into the small intestine. And it could also be you've had a lot of antibiotics. You know, people who've had multiple courses of antibiotics will often have an overgrowth of the wrong type of bacteria in their small intestine, or people on steroid drugs or people on immunosuppressant drugs. So medications can cause this SIBO as well. And SIBO is the most common cause of FODMAP intolerance, which is the most common cause of bloating.
Is there a
So,
test for SIBO?
there is not a real accurate test for SIBO, but we can do a breath test where we measure the amount of hydrogen gas that is being produced in your gut. It's called a breath test. It's not 100% accurate, but in people who have a really bad SIBO, it will be abnormal. But it may not pick up just mild to moderate amounts. You can have a breath test. Yeah, so it's really something that you would suspect by going on the symptoms that you have. If you're having a lot of bloating, reflux is a common cause of esophageal reflux where you get the heartburn, then it's definitely worth, going on an elimination diet. And there's different types of elimination diet, including the low FODMAP diet. You can also take a natural herbal antimicrobial. We've got a picture of one here called Bactoclear, which has got essential oils, clove, thyme, berberine, and it has an enteric coated capsule. So those essential oils are not broken down in the stomach acid. So they get through the stomach into the small intestine where they can do their job of cleaning up the bad bacteria. So we can use natural herbal antimicrobials such as the Bactoclear and also probiotics. Some people find that the probiotic called Lactobacillus reuteri is helpful for SIBO. Have you heard of that one?
Never heard of it.
Yeah, Lactobacillus reuteri. Some people find that very good. So the thing is, it's all about, getting those gut bacteria under control.
Do you recommend doing a sequencing your gut biome to see which species you might be missing or
Yeah,
lowering?
you can have a microbiome test on your feces. Now, it's interesting that if you change your diet radically, your gut microbiome will change quickly. So if you're going to have a gut microbiome, you want to have it while you're on your regular diet before you actually improve your diet. But often in people who've taken a lot of antibiotics, we see a very disordered microbiome in that test. And then we can use probiotics and we can also use supplements to try and help heal the gut. So the amino acid glutamine is very helpful because it puts a lining on the gut and it actually can heal the gut. The gut lining is the epithelial cells, and they actually use glutamine as a nutrient for themselves. So it's used by the gut lining rather than getting absorbed into the bloodstream. Some people find it very good, or you could try Ultimate Gut Health Powder, which has got glutamine, aloe vera, slippery elm, and some probiotics. So some people find this excellent. And, we've had people who've been on antacid drugs for many years who take these powders and they get a tremendous improvement because they have got such an inflamed gut. If you're not making enough hydrochloric acid, then you will get an overgrowth of bad bacteria and a lot of fungi like Candida. I had a patient that comes to mind who was very interesting. He had been on antacid drugs called proton pump inhibitors for a decade. And he didn't really have a proper review of the medication. And he brought me a picture of his gastroscopy. And it was shocking because his whole stomach and the first part of his small intestine was lined with candida, like a thick white film of candida. And that's what happens when you don't make stomach acid. You will get an overgrowth of fungi, yeast such as candida, and unhealthy bacteria. So stomach acid acts like a really good natural antiseptic for the gut. So people who are on antacid drugs, some people do need to be on them because they may have had gut surgery or they may have had severe ulceration of the esophagus. Those people should take hydrochloric acid in the form of betaine hydrochloride when they eat. They should take it in the middle of their meals. Otherwise, they're not going to digest the protein in their food and they'll get an overgrowth of bad bacteria. So you can get betaine hydrochloride capsules. And you can also take super digestive enzyme capsules, which have hydrochloric acid, ox bile, and digestive enzymes all in one capsule. So it's interesting that the gut microbiome is greatly influenced by hydrochloric acid, isn't it? Yeah, we need acid. It's very important. So if you're on an antacid, you should take betaine hydrochloride in the middle of your meal. You might need 1 capsule, you might need 2 capsules. See how you go. You don't take it on an empty stomach. You take it in the middle of a meal. Yeah.
What do people typically get prescribed antacids for?
Yeah, well, people are given antacids for a lot of things. Sometimes just for bloating, sometimes just for reflux, for irritable bowel, and sometimes they work and they get a relief, but then they've got the consequences of having a disordered gut microbiome and impaired absorption of amino acids and minerals. So you need hydrochloric acid to absorb minerals and amino acids because you're not breaking down the food without the hydrochloric acid. So, the food particles are too large for you to absorb the nutrients. So it's very, very important that people who are on proton pump inhibitors are taking something to help their absorption of nutrients. And I don't think this is emphasized enough to people. A lot of people will be on antacids because they have reflux causing ulceration of the esophagus, or they may have really bad reflux that's actually going into their lungs. And they can get a fibrotic lung, which can cause severe lung disease. So, some people do need antacids, but a lot of people are given them and they don't really need them. They just need to fix their diet and get their gut microbiome working properly, and just to take a supplement that's got your hydrochloric acid, your ox bile, and your digestive enzymes. So I'd rather treat the cause, and then you can actually heal the gut. So healing the gut is critical because we know that, good health begins in the gut. If your gut is not healthy, well, nothing will be. Your mental health could suffer, your immune system, your energy. Now, another thing that can help to improve your gut microbiome is fermented foods. So sauerkraut, kimchi, kombucha, things like that. And you can make your own fermented foods at home. Some people find that full-fat yogurt is good, and I know that some people make their own yogurt with a probiotic like Lactobacillus reuteri, and that can help a lot as well. So you don't just have to take a probiotic supplement. You can also increase the amount in billion-fold of good bacteria in your gut with fermented foods.
I'm actually going to post a. Have you heard of a song? Have you heard of a band called Formidable Vegetable?
No, I've heard of a brand of fermented vegetables called Peace, Love and Veggies.
Oh, I love that.
And
That's
that's
so
made
cool.
in Byron Bay, which is a hippie town in New South Wales.
Totally. So they make a great song. I'm going to post it in the comments. They make a great song called Kimchi, which actually includes how to the instructions of how to make kimchi. So
Oh, yeah. Well,
that's
kimchi's
it's
got
both
chili in
entertaining
it.
and fun.
Yeah,
Hmm.
it's got chili, right? I
Yeah.
like it. Yeah.
Oh, it's great. I
Um,
love kimchi. Every time I
yeah.
go to like a Korean restaurant, I always just like keep it coming. Keep the kimchi coming.
Well, that's good. You must have a very healthy gut.
Oh, it's getting better.
Now, I thought we'd just mention the vagus nerve, because the vagus nerve is a cranial nerve that comes from the bottom of your brain and goes all the way to your anus. It's the longest nerve in your body. And you can see there's a right vagus nerve and a left vagus nerve. And it travels through the neck into the chest cavity where it supplies the nerves to the muscle of the heart, and also goes through the diaphragm to supply the gallbladder, the pancreas, the stomach, and all of the intestines. So obviously you need a healthy vagus nerve. And the vagus nerve sends messages to the gut, but also messages come from the gut and go back to the brain through the vagus nerve. So it's a two-way highway. So your brain and your gut are communicating through those nerves, through those vagus nerves. And there's a lot on the internet about how you can improve your vagus nerve with exercises like deep breathing and humming, and pressing different trigger points in your body. So the vagus nerve can be damaged by things like the herpes virus. And if the herpes virus is damaging your vagus nerve, you really should take a selenium supplement, because selenium is like an antiviral birth control pill. It will reduce the ability of the herpes virus to damage your nervous tissue. And I've seen this in patients where they've had damaged vagus nerve, given them selenium, and a lot of their symptoms have improved.
How would you know if you've got a damaged vagus nerve?
Well, how do you know if you've got a damaged vagus nerve? Because it's such a long nerve that innervates so many of the automatic functions in the body, you can get a huge array of symptoms. For example, your voice box, your vocal cords may not work properly. You may have irregular heartbeat. You may have a diaphragm that doesn't move properly, because the vagus nerve is innervating the diaphragm. So you may get shortness of breath. You may have a lot of digestive issues. So you may have a dysfunctional gallbladder that's not contracting properly. You may have a lack of hydrochloric acid. You may have a lack of bile. You may have irritable bowel syndrome. You may have constipation. I mean, because this nerve is so long and it innervates so many parts of the body, the symptoms can be very diverse. And a lot of people have symptoms and don't realize that it's coming from the vagus nerve. It's hard to diagnose. You just have to be aware of what the vagus nerve does. Yeah, and things that can damage the vagus nerve, of course, is diabetes. So diabetes will damage all the nervous tissue in your body. And it's a common cause of neuropathy, which is diseased nerves. So the vagus nerve may not work as well as it should in people with poorly controlled diabetes. So you may find that just going on a low carb diet could really help your blood sugar control, and that could help your vagus nerve. The other thing, you may find that a magnesium supplement helps your vagus nerve, because magnesium is critical for electrical activity in the nerves. So, it is important to be aware that your vagus nerve is critical for good gut health. and be aware of all the different things that can attack your vagus nerve. And, you know, we get emails from people from all over the world that we answer with people that have all sorts of chronic problems. So feel free to email us at liverdoctor.com and we will get back to you. We have a team of naturopaths, doctors and nutritionists, and, you know, we love to get your emails. So it's very, very important that people do get a proper diagnosis. I mean, they've got their own doctor, of course, and you should always go to your own doctor. But if people have a chronic gut issue that is not getting better with conventional medicine and conventional drugs, think about functional medicine. What's not functioning properly in your body can often be fixed with nutritional medicine. So you've got to put on your Sherlock Holmes cap. You know, you've got to think like a detective. Okay, what are we missing here? And often it's something simple.
I love the process of functional medicine. My first appointment was so much more intricate and comprehensive than any doctor's appointment I've ever had, where they asked everything from how was I born? Was I born like natural birth or C-section? How long was I breastfed for? What kind of major events did I have in my life? How do I sleep? You know, everything.
Yeah,
sunlight, grounding.
that's right.
Number one.
See,
Yeah.
sleep is so important for your gut because your vagus nerve is the cranial nerve, comes directly from your brain, and we know that deep sleep is so important to reduce brain inflammation and therefore inflammation in all the cranial nerves. So, you know, people who don't sleep properly can have gut issues just from that. So, you know, just basic tips to help your gut. Try and enjoy eating, be relaxed, so that you take time to make enough saliva, because your saliva has got some enzymes which help to begin the process of digestion. Avoid drinking large amounts of fluid with your food because that will dilute your digestive juices. Don't drink too much alcohol because that can cause a leaky gut. And you can also try taking some apple cider vinegar during the meal, sipping some apple cider vinegar, maybe 1 tablespoon, maybe 2 tablespoons in a small amount of water. You can sip it during your meal. Don't have apple cider vinegar on an empty stomach. You can also take digestive enzymes, ox bile and betaine hydrochloride. Particularly if you've lost your gallbladder or you have a dysfunctional gallbladder, you're not producing that squirt of bile that you need when you eat. So some people find that by taking ox bile in the middle of their meal, that it really does overcome their bloating and their poor fat absorption. So gallbladder problems are very common, and you can have a scan of your gallbladder to see if it is contracting. And I've got some good videos on YouTube about the gallbladder. We've got a question there too from Robin Cottrell. Hi, Robin. She's asking, how do you clear bile ducts that are clogged up? Well, if you had completely clogged up bile ducts, you'd be jaundiced. So, you know, you'd have yellow eyes and yellow skin. And when there's complete blockage of a bile duct, that's usually caused by a stone. But generally speaking, you won't get clogged up bile ducts. You might have inflamed bile ducts. And one of the best things for reducing plaque or thick mucus in any tubes or ducts is N-acetylcysteine because it clears up biofilm. So you could look at trying N-acetylcysteine capsules. You take one in the morning on a rising with a whole large glass of water, and then another one mid-morning with a large glass of water, and another one mid-afternoon with a large glass of water. And you may need to do that for 1 or 2 months, and that may unclog your bile duct. Of course, drink a lot of water because that's going to help to make your bile less concentrated. And, have a blood test to check your liver function. That's very important because your liver is making the bile and you want it to make good quality bile.
Just a quick question, Sandra, for myself.
Yeah.
So you're saying like don't drink too much liquid during your meal. How long do you wait until after the meal where you can quench your thirst?
Well, I think I would wait half an hour. Yeah, and
Okay.
and then only have small amounts. If you have really bad bloating and weak digestion, I would wait a whole hour. But generally speaking, I'd wait half an hour because you really need those digestive juices to be concentrated to mix with the food in the small intestine. Yeah.
Okay, good to know. And
Yeah.
also, I remember when I was studying functional medicine health coaching at the Cresta Institute, one of the things they said was like, yeah, sort of dovetailing in your point about chewing your food enough. I think one of the teachers, I remember saying something like 24 chews per mouthful, which is a lot more than like I realized. So I try and, if I think I'm eating too fast, I try and sort of count. And then I look at my like step kids and they get it down in 3 chews.
Good. Yeah, so we've got a comment too about a lady, ginger and garlic. She bought a instant pot pressure cooker to cook legumes. That might help. And soaking legumes for 24 hours before you cook them is a good idea as well. It makes them a lot easier to digest. And also having that little bit of apple cider vinegar during your meal can also help you to digest legumes. Yeah. So you have a slide presentation as well, Igor, that you'd
Yeah, I've
like
got a
to
few
bring up?
slides.
Yeah.
Yeah, just about the gut-brain connection, especially
Yeah.
around
Well, it's so
around our mindset.
important. I mean, our gut is communicating with our brain, as we've discussed, through the vagus nerve. The message goes from the brain to the gut and then from the gut back to the brain through the vagus nerve. And also, if you have the wrong gut bacteria, and particularly if you have some really nasty gut bacteria, they will produce toxins. They're called endotoxins, which can escape from the gut into the bloodstream. And of course, that will go back to your brain. If you have a leaky gut, you'll often have a leaky blood-brain barrier, and those bacterial toxins will get through to your brain and cause brain inflammation. And that will affect your mood and your memory. So, your mental health is tied up with your gut health in many different ways. And, a lot of people find that when they give up the carbs and they just go on a high fat, high protein diet for a while, that changes their gut bacteria and their mental state is so much better. Their anxiety goes away, their mood disorder goes away. It's incredibly powerful, that communication between your gut and your brain.
I've just posted a link to your ebook in case
Oh,
people
yeah,
miss it.
great. Yeah.
Cool. All right, I'll put up my slides.
Yeah.
1 second. First of all, hello Ben and Danica. Got some friends joining us today, which is great.
Yes.
Yeah. So yeah, like Sandra said, thanks for that, Sandra. Really trying to make that connection between our mindset and our gut health, and it's quite an interesting symbiotic relationship. So Yes. So something that Sandra touched upon is most of our immune system actually lives in the gut. Um, so yeah, gut-brain axis, that's that vagus nerve where your gut talks to your brain and vice versa. Gut itself has millions of neurons, which is interesting. I think
Yeah,
we're only
true.
really starting to scratch the
Good point.
surface about our actual gut brain. Like we've got a little brain down there, which is pretty
Yeah,
wild.
yeah. It
And
makes
I think there's,
serotonin. Yeah, the gut
mm,
neurons make serotonin, and,
yeah,
of course, your gut microbiome influences what type of neurotransmitters your gut will make, yeah.
that's a great point. And we've got some of the highest prescription rates of antidepressants in Australia. Yet when they prescribe antidepressants, these powerful medicines, they never look at the gut health. And I think that's where they should start. Because if someone's gut health is poor and not producing enough serotonin, then that's probably a great place to start.
Definitely. Well, actually, there is a brilliant, psychiatrist, American psychiatrist on YouTube, very experienced doctor, and he finds that when he puts his, patients with bipolar and schizophrenia on a high-fat, high-protein diet that excludes carbohydrates, their symptoms go away.
Mm.
And the minute
Is
they
it-
go back on the high carbs, their psychotic symptoms come back. So the effect is very reproducible and very powerful. So, even some conventional psychiatrists out there now are recognizing the profound effect of what you eat on your mental health.
Yeah, there's a great book I read a few years ago called Grain Brain by Dr.
Yeah,
David Perlmutter.
yeah,
Really interesting. It explores that.
yes,
So yeah, poor gut health affects your mood, obviously, because of that serotonin production can cause fatigue, inflammation. Yeah, Sandra talked about before. So yes, obviously you've talked about the physical causes of gut issues. So we've talked about that. And really interesting is that gut health influences brain health and mental health and vice versa. So your thoughts actually affect your gut. So stress and anxiety, they activate your sympathetic nervous system. So that whether, I'm sure everyone here has heard of your fight or flight reaction. So
yes,
when we're in fight or flight, it actually releases your glucose stores in your glycogen in your muscles, and it floods your body with glucose, which makes sense because if there's like a snake there or something that's going to attack you, you want all the glucose, you want all the energy to get out of there or fight whatever the danger is. But if
yes,
we're really in that situation in our day-to-day lives, yet our sympathetic nervous system is always activated by our boss bearing down on us because of an upcoming report or
yeah,
issues with our kids or relationships or whatever. So that these causes of stress which aren't life threatening trigger the same system in our body. And when that's triggered long term, then that causes gut issues and causes a whole lot of issues as well, not just gut.
yes,
Yeah, chronic and negative emotions suppress digestion. So yeah, it actually impairs our ability to properly digest our foods and therefore impairs our immune system. So I'm sure everyone's experienced when maybe you're going through some kind of big life event. You might have a breakup or someone close to you has passed on. And often we get sick because our immune system is impaired because um, that grief or that feelings of sadness actually impacts our digestion and our immunity. It's fascinating.
yes, exactly, yeah,
So yeah, what you hold in your mind, you hold in your gut. It's a really important thing to remember. So
yeah,
there's ways in NLP that we can actually address that. So I can look into that in the next slides. So yeah, one way is like when you're going through some really difficult emotions is don't forget the power of meditation, breathing, and journaling. These are all really powerful and really simple techniques. Like breathing, we all do it every moment, but just taking control of your breath just for a few minutes can have a massive impact on your parasympathetic nervous system. So there's a great exercise called 4-7-8 breathing, which I start all my coaching sessions with it because it's so powerful and it's so simple. It's basically 4 breaths in through the nose, hold for 7, and then out through the mouth for 8. And you do that 4 times, and you'll find that on the last round, you'll just feel like all that anxiety or stress just melt away. And so that's a really great one you can try.
Yes,
Journaling,
worthwhile.
it's definitely, and it's really important just to get down your thoughts and worries and don't keep them all bottled up there.
Yes.
Yeah, these are great. So limiting beliefs. So I've touched upon these in previous episodes, but it's worth revisiting. So when people think like I've got gut issues, and there might be allergic, there might be gluten intolerant or even celiac. So a common belief is, oh, my body's broken, my gut's broken, which puts us in a state of chronic stress. If we're constantly anxious about, we're thinking, oh, there's no point fixing it, we're not hopeful, then we're not going to heal as well. So whereas if we shift that limiting belief to food always makes me, so if we shift that to my gut is healing or my body's healing, then it makes a big difference.
Yes.
So these beliefs trigger chronic stress. Yeah, exactly. So how do we rewire the gut-brain connection? So I've already talked about it. Anchoring calm before meals. So if you get anxious before meals, thinking what's in this food, like how am I going to react to it, then that anxiety will actually impair your digestion and cause you to react worse to it. Ironically, so it's a bit of a catch-22. So the way we do that is do something like the 4-7-8 breathing exercise before you eat if you're feeling that anxiety. Try anchoring. Anchoring is basically it's attaching an emotion to an object or a certain movement. So it could be like rubbing the earlobe, which ironically enough relaxes your vagus nerve. I think you said in a previous episode.
Yes.
So find something that calms you, or create something that calms you. It could be like rubbing your earlobe, and when you do that, think about all the calm times you've had in your life. Just visualize them and do that as often as you can. And when you're feeling calm next time, rub your earlobe, and then that can be your anchor. So that way, when you're feeling anxious before the meal, you rub your earlobe, you straight away put yourself in a feeling of in a calm state, and therefore you'll be able to digest your food much better. So that's a huge one. So reframing beliefs, we talked a bit about that in the last slide. Using visualization to send safety signals to your body. So instead of thinking like, oh, this is going to, how you often visualize how bad we're going to feel if we eat something, and we're like, oh, I'm just having a cheat meal. But then, so instead you visualize that your body is healing, visualize that your gut is healing, visualize feeling good actually after that meal, visualize feeling content and really enjoying that meal. So that can be really powerful too. Timeline therapy to release anger, sadness, fear, guilt, and shame. So that's a much bigger process. This is what I go through in my coaching practice, and that's really powerful. And that's a permanent fix. If you're holding on to some trauma from your childhood, then working with someone like myself on timeline therapy to actually release that permanently can make a huge difference.
Yes.
So language it heals versus language it hurts. Like as you can guess, neurolinguistic programming, it's language. It's the language that we use. Our self-talk makes a big impact on our health and our mental health, and therefore our gut health, and therefore our physical health. So if you think I can't eat anything without reacting, again, you put yourself in that anxious state and you impair your digestion. But if you replace that limiting belief with the belief that my body is learning how to digest and heal, then you're totally putting yourself in a calm state, and you're totally going to digest that food much better, and therefore you get more nutrients out of it, and then therefore you'll feel better. So it's a positive cycle rather than the vicious cycle. Upward spiral, I like to say. Again, so I'm broken, replace that with I'm on a healing journey. Yeah, so your nervous system believes your words. It doesn't check what's on Google, what's on ChatGPT. It believes everything we say. So
Mm.
that's why it's important to choose the words that we use with ourselves wisely.
Yes, I agree.
Yeah, so this is a reminder. So yeah, my own story of my own. I don't know if some people that know me or maybe seen some previous episodes know that I've gone through some major issues with my gut health, which culminated in my autoimmune condition of alopecia.
Yes.
So yeah, that was when I was at that point, which I've got sort of the full story in the autoimmune episode. If you guys want to check that out. um I was experiencing so much gut dysbiosis that I wasn't able to eat. I was able to eat very little or tolerate very little. um and that was a culmination of chronic stress and just taking on too much on my shoulders.
Yes.
um and that obviously had that impact on my gut, and vice versa. So obviously, when I started working with a functional medicine practitioner, they helped me, yeah, put on that detective's hat that Sandra mentioned before, and found my imbalances. They found that I wasn't sleeping very well. My quality of sleep wasn't very good.
Yeah.
There were certain things I needed to fix up in my diet. So initially, I went on an elimination diet, and then slowly I started reintroducing as my gut was healing. But it
Ah,
wasn't, so the functional medicine practitioner helped me with all the physical aspects. And then it was actually the journey of shifting away from being in a place of chronic stress all the time. So no longer taking on that role of being my mother's uh, healer and helping her get out of that chronic depression that she was in, and various other things, and also realizing that I'm not this kind of like, I can do what I can, but I was single-handed. I was trying to take on too much with like the climate fight and everything like that, and shifting to realizing that, okay, I'm going to focus on what I can achieve within my
mm,
community and within my within what I can actually affect in my life. So
yes.
that made a really big shift. And so instead of thinking I'm not doing enough with my friends, with my family, with the environment, I I realized I shifted that limiting belief to that I am doing I'm doing my best. I'm doing the best that I can,
Yes.
which made a big difference.
Yeah, that's good advice, Igor. A lot of people um, try and be perfectionists,
Mm,
and they beat themselves up because they don't achieve everything. But you can't fit everything into a day. It's just
mm,
impossible. So prioritizing is very important. And I always say to people, look, what's the most important thing in your life is staying alive.
yeah,
Um, it is. It's very basic, right? But uh, people lose the perspective, and your health is everything. So you just take the time to look after your mental, spiritual, physical health, and then you can achieve a lot more anyway. So you got to put yourself first. Your
mm,
health is everything. And, people try and be perfectionists. I mean, I know some doctors who have actually committed suicide because they couldn't keep up with the workload. They were trying to save the
mm,
world.
mm,
Um, you can only do your best and be proud of what you achieve.
yeah,
So you've got to really learn to relax, and
yeah,
that will help your gut health enormously because through the vagus nerve, right? It's incredible. The gut brain connection. Now we've got a question from Kay. Hi,
I was just
Kay.
gonna sorry, I was just gonna wrap up. um,
Oh, okay.
yeah, yeah. So yeah, so like dovetailing what it's pretty much what you said basically. So heal the gut physically, heal your nervous system and beliefs, and yeah, and get your gut, get your health and your mindset to work together towards lasting health and lasting change. So that's a huge
Exactly.
one.
Yeah.
Yeah, so mindset's medicine. Yeah, if anyone's curious to explore coaching, I do offer a free initial consultation, so you can just grab a screenshot or take a photo of that with your phone and follow that up if you'd like.
That's
But
great.
yeah,
Yeah.
we'll leave it there. And
Everybody likes a freebie. Yeah, so to answer Kay, she's got diverticulosis, which is little pouches that form in the colon, and food and bacteria get stuck there. And then that can lead to diverticulitis, which means the pouches are inflamed. And this can lead to an abscess, a rupture of the colon. It can be very, very dangerous. So we call it diverticulitis. And Kay has been everywhere looking for help. She's just recently been to emergency department. So obviously she had a severe infection in the pouches, the diverticula in her colon. And when it's that bad, you need intravenous antibiotics. But long term, what are you going to do? Well, I don't know what you've done, Kay, but I would be really looking at your diet, and I'd be using some natural antimicrobials like the Bactoclear. I would be making sure you're not constipated. One little tip for constipation that can help is linseed, sunflower seed, and almond. So instead of eating cereal grains, you may find that the powder, the LSA, linseed, sunflower seeds, and almonds, would help to give you that fiber. You can make it fresh yourself in a coffee grinder and freeze it. Keep it in the freezer and have about 1 to 2 tablespoons a day. Some people find that good. Some people have such bad diverticular disease in their colon, and there may just be one segment of the colon, may just be the descending colon or the sigmoid colon, and they have to have that resected because it's so diseased. They have to have that bit removed. So you want to go to a top specialist, not just a gastroenterologist. You want to go to a large bowel surgeon. So a bowel surgeon, and see how diseased is that part of your colon. Does it need resection? Because going to emergency like that, you don't want to end up with an abscess or a ruptured colon. Go to a top bowel surgeon. Okay. We had another question too. Let's have a look. We had a lady who says if she's taking Bactoclear, can she do that every day long term? Yeah, if you have really bad SIBO, you can take 1 or 2 a day long term. Some people just need to take it for a couple of months because they're clearing up their microbiome and they're starting to improve their diet, but it's quite safe to take for longer. So you take the Bactoclear in the middle of your meal. With the Ultimate Gut Health powder, you would take that away from food in room temperature water. And so you just stir it into water, and you can take some when you get up in the morning, 20 minutes before you eat, and then some in the middle of the afternoon if you feel you need more, and then some before you go to bed at night. And that will help to heal a gut while you're sleeping. Yeah. So it's amazing how these natural things can really help, because, so many people are taking proton pump inhibitors, and they're taking laxatives and things, and, they're just treating the symptoms. We need to treat the cause. That's critical. We need to heal the gut. Yeah, so I think we've come to the end of our podcast here on gut health. I don't know if there's any more questions, but feel free to send us an email at liverdoctor.com if you do have any questions.
Well, we got one more coming in last minute.
Oh.
I have latent TB, and she thinks autoimmune is from TB. Okay. I think he's referring to a doctor, maybe. Not sure.
No. There's another one from Levi or Levy, and they have Sjogren's syndrome. Now, I have a really good video on Sjogren's syndrome on YouTube. Sjogren's syndrome is an autoimmune disease where all your mucous membranes dry up, so you get dry eyes. It can affect the gut too. You know, it can damage the lining of your gut so that your gut lining becomes very dry and doesn't have the right secretions. It can cause your mouth to dry up so you don't produce saliva, so that's going to affect your digestion. So, you know, it's a nasty thing to have. So I would definitely be following the autoimmune protocol. We have a book, Healing Autoimmune Disease. And also some people find the GAPS diet, GAPS, from Dr. Natasha McBride is very helpful for autoimmune. But with Sjogren's, you know, you definitely need some supplements to calm your immune system. You'll need selenium, you'll need vitamin A, you may need NAC. So definitely seeing a functional doctor. You can send us an email. But have a look at the video on Sjogren's, because it goes into the cause and it goes into what you can do. It's a very unpleasant thing to have, obviously.
Cool. We'll wrap it up there.
The drying up disease, that's what I call it. Yeah.
Great.
Okay. Great.
Thanks everyone for watching and participating. I think that was I think that was a great episode. I think people got a lot out of it, and hopefully hopefully people follow up.
Yeah, well, we hope that we've helped you people out there with gut problems. And it's interesting, the saying, trust your gut, because, you know, when you do have a decision, you've got to trust your gut, don't you? You know, your gut and your brain together will tell you.
Exactly. I have a gut feeling we had a good episode. So thanks, Sandra.
Great. Okay. Well, great to see you, Igor, and great to hear from everyone out there who's following us, and we look forward to our next video with you. Bye.
Likewise. Take care.
Well, thanks for being part of our webinar. If you have any questions or new topic suggestions, email us at support@liverdoctor.com. And don't miss our next webinar. Be sure to follow us on social media and subscribe to our newsletter at liverdoctor.com. Bye for now.